It's been a vaccination summer for most Canadians, but as the pace has slowed down, the Delta variant has kept COVID-19 raging on, and in some regions, it's hit hospitals hard.
You're in a province like Alberta and Saskatchewan, we don't have ICU capacity. If you get into a severe car accident or something like that, that literally means that you might not get the critical care support you need in order to have your life saved. So that is the kind of desperation we're at.
A year ago, Canada averaged 500 new cases a day. Today, it's 3,500. Cases have increased by 23% from last week alone. So have hospitalizations. Deaths are also up by 57% since then. Federal government projections suggest next month could be worse.
We will see accelerations. So we've got, not very much time.
If the virus continues to spread at the current rate and no extra measures are taken, the daily cases could triple. But federal modelers predict reducing the spread by 25% could flatten the curve.
If we want to avoid what we experienced in a second and third wave, especially with all of us, going back inside, with the fall and school and the colder weather, let's get our vaccination rates up.
Officials are looking particularly at adults under 40. A third of them still haven't had both shots, and they're the bulk of new cases. But while vaccine mandates remain controversial and patience wears thin for stricter public health measures, both may be needed to control the outbreak.
Getting the public to buy in to say you need to see less people, you can't go to certain places, getting businesses to buy in to say you can't do as much business. It's going to be really tough, and this is part of navigating this wave. We have a viable solution.
So Vic, bottom line here, does this modeling mean we're looking at more lockdowns in the future?
Well, both Doctors Tam and New mentioned lockdowns are always an option if things don't improve, but that, of course, nobody wants to go there again. Instead, they say targeted restrictions may be needed in specific places where cases are rising and hospitals get overwhelmed. Now, a recent positive development may also avoid the need for that. After vaccine certificates or passports were announced in BC, Manitoba, and Quebec, vaccine bookings actually went up, which means fewer people eventually will be getting severely ill.
Okay, thanks so much, Vicadopia.
You're welcome.